We are here with Ashley Stewart, an up-and-coming nurse, and today she is going to take my blood pressure and possibly check to see if I have hypertension.
Hi Ashley. Hello Jolene. It's nice to see you today.
Thanks, you too.
First I'm going to start by just explaining a little bit about my equipment. This here is our blood pressure cuff. Inside there is a bladder of the cuff that should circumference about 80% of your arm. The size is very important in making sure we have an accurate reading. You are in a nice position. You're sitting up straight with your arms supported at heart level with your feet flat on the floor. So I'm just going to have you lift up your shirt there and we will apply the blood pressure cuff. Have it snugly fit on your upper arm with the artery indicator clearly above. Then I'll take my stethoscope and we will listen to see where your blood pressure is.
Alrighty.
I'm just going to have you relax and ask you not to talk while we take it. Okay, Jolene, your blood pressure was 104/78. Okay. Now, this is a normal reading. Blood pressure we'd be looking for to be, it should be under 120/80 is a good blood pressure. If it were over that mark, we would consider it to be pre-hypertension if it were under 140/90.
Okay.
Once it becomes 140/90, we're looking into diagnosing with hypertension. We would want to take more than one blood pressure and average those two readings, and then we would ask you to come back again and to check on those. So a few things you could do to work on lowering your blood pressure would be to eat a proper diet, work on exercising, avoiding caffeine and smoking would all be things to help your blood pressure.
Alrighty. That sounds great. I do all of those, so we're good to go.
Do you have any other questions for me, Jolie?
I do not. Thank you for your time.
You're welcome. Because you had expressed some concern about your blood pressure, I also have some information here that you can bring home and review.
Great. Thank you. This will be very helpful, Ashley. And I will be sure to tell my family and friends to get tested.